Hey there, Molly Sullivan here from Aquacare Rehab in Millsboro, Delaware for part 2 of our series. With me I have Jimmy Mundy, student at UMES. So we went over finding a neutral pelvis and breathing diaphragmatically in our previous video. And for this one we're going to go through activating the muscles of your abdomen into an abdominal brace and contracting your pelvic floor. With that we're creating a nice big surrounding contraction of your abdomen to help to stabilize the contents of your abdomen, which include your spine. So go ahead and laying down on your back again. Before we get into contracting the abdominal muscles, we want to go back and we want to find that neutral pelvis that we just reviewed. So finding your triangle, going through, tilting forward, tilting backward, finding that nice neutral position. And again, once we find that position, we really don't want to move from this position. So as we're contracting the muscles of your abdomen, your body's going to have a tend to either pull forward or pull backward. We really want everything to stay nice and still where it's at. So once we're here, what I want you to do is I want you to take the fingers and I want you to find those big bony spots that we found before in the front. And what you're going to do is you're going to take those fingers and you're going to fall just on the inside of those bones. So you should kind of be in a nice little divot of muscle and flesh. Good. Now that we have the neutral pelvis, we have our position here. We're going to go through and we're going to try to activate the abdominal muscles. So breathing here, when we think about the abdominal muscles, we're thinking about getting all the muscles of your abdomens, the ones that run up and down, your six-pack muscles, your obliques, and the muscle that runs from the back around to the front to contract as a unit. These muscles are your endurance muscles. They are not your pick up really heavy weights off the floor muscles. So when you're thinking about this, what I want you to go for right now is a light contraction. So with your spine staying still, what we're looking for is you're going to tighten down your abdomen like you're going to accept a really light punch. As you do that, what you want to make sure you're doing is that your pelvis does not tip forward or backward as you're tightening in. As you get that tightening, what you should feel underneath your fingers is you should feel a light pressure into your fingertips. If you're doing this activation appropriately, you should feel that pressure push into your fingertips and stay into your fingertips. The biggest thing about this is most people are able to get an increased pressure in their abdomen, but they do it by holding their breath half the time. So what you want to do, once you feel that you've gotten the contraction, is that you should be able to maintain it while you take a breath in and breath out. If you lose it as you try to take your breath, you probably need to reset and try again. For this one, usually what I tell people is that if you keep losing it every time you take a breath, try to make the contraction even lighter. If you're trying to bear down too forcefully, you're going to pull other muscles into the contraction that really shouldn't be there. So a few other kind of tips and tricks is that pretend that you put on a really, really, really tight belt. And what you're trying to do with this, as you tighten up your abdomen, you're trying to break through that belt. You're trying to push out into your hands through all sides and kind of break through that really tight belt. So as you're contracting, again, you should feel those muscles tighten in the front, through the side, and through the back. The pelvis should stay nice and neutral. All right, once we've got that, the next thing we want to add in is a pelvic floor contraction. Pelvic floor contraction is really important because if we're stabilizing at the top with our diaphragm, we're getting a nice contraction around the abdomen, we're having a lot of pressure pushing downwards. So we want to make sure that the pelvic floor is stabilizing and pushing upwards so they're not creating too much downward pressure. So a pelvic floor stabilization is kind of the sensation like you're stopping the flow of urine. So this contraction works really well with your abdominal contraction. So as you lightly tighten up through your abdomen, what you want is to get a light pelvic floor contraction. So from between your legs coming up towards your head, it should feel almost like an elevator rising up. It should be really subtle and your bottom muscles should not squeeze really forcefully together. If you're having a hard time doing this one, I would suggest sitting up and trying it seated. So go ahead and sit up for me. So in the seated position, you can go through the whole same sequence where you're finding that neutral pelvis, sitting up nice and tall, getting that abdominal contraction. Now when you try to do your pelvic floor contraction, if you're seated, what you're going to find is that if you're doing it correctly, you'll actually feel a small lift from the pelvic floor lift away from the surface you're sitting on. So that's a nice cue to know whether or not you're doing it correctly. And again, all of this is kind of your baseline unit of exercise, and we really build off of this for every other core stabilization exercise that we do. So go ahead and practice. If you have any questions, give us a call here at the office or stop by for a free screening. Thanks.